the data were collected between September 2019 and January 2020. As I already said, we measured descriptive norm by asking how much do you use and how much do you think others use, and we measured the injunctive norms with the question how much do you approve of this use and abuse, and how much do you think others approve of those use and abuse. So for the 12 to 26 years old, we wanted to know a bit more about their alcohol use and perception of peers' use and opinion, cannabis, and online gamings. So here the population, as I said, was aged from 12 to 26, and they were living in the EMR. The majority came from the province of Liège. As you can see, it's more than 2,000. That's because of our great university in Liège. We had some very nice network to reach the students, so that's the reason why. Not very surprisingly, it's usually a bit more women than men that answer surveys, so here it's pretty much as usual, and we had a majority of people aged from 20 to 26, again, students mainly from the University of Liège, or at least surrounding in the Liège province. So what we found here is that indeed we found some overestimation of peers' use of alcohol, but also an underestimation of protective behavior. So as Guido already said before, we have a tendency to overestimate risky behavior and underestimate protective behavior. And here we found exactly the same. A lot of people thought that not a lot of their peers were never drinking alcohol, whereas it was almost, well, more than half of them that never drank alcohol, or at least not in the last month, which is, for me, I think, very encouraging, because people don't drink as much as we think they are. So that's cool. And we have the same kind of results for cannabis use, with also overestimation of other smoking cannabis. Here with 15% thinking that their peers are using at least once a week, whereas it's less than 3%. And again, what is very encouraging, even though the underestimation is not as, well, it's still big, but it's not as surprising as we can see with the alcohol. The good thing is that, well, 93% of our respondents do not smoke, like, ever, or not at least in the last month. So that's, again, very encouraging. And when I talk about the project a few years ago, at the beginning of it, I talked with one of my colleagues at a conference, and I said, well, you know, a lot of people think that everyone smokes cannabis in the EMR, and I said it's not that much, and I think at that time I gave him some sort of like 4% or something, because it was at that time the number I had, and he said, really? I didn't know that. I thought that it would way much more than that, and I was like, see, already working, already overestimation there. Yeah. Then we also took a look at gaming. Well, as you can see here, for the overestimation, underestimation is less clear, because we had more of a, like, a third didn't play, a third played but not so often, and then a third like played a lot. But what is, again, very interesting here is that even though there are some people gaming a lot online, they actually almost never choose gaming over social life or doing their own homework. So they don't really, well, at least they report that they are not really impacted by their gaming on their social life and academic life. So again, it's a very encouraging results and seeing that they have a good handling over their time playing and gaming. As for the opinion, we can see for the cannabis that's where people underestimate the disapproval of smoking of their peers, and so they thought that they themselves disapprove more of smoking cannabis than what their peers do, and we see that, well, a lot of them actually think that it's not okay to smoke cannabis, and for the alcohol it's less, yes, it's less marked, but again, it's a very good thing about cannabis approval and disapproval here. So what we can remember for all those results is that, well, the majority of the young people aged from 16 to 18, well, they never drink alcohol. And for the 18 to 26, well, the majority of them just drink less than once a week, which again is very encouraging. And for the cannabis, of course, as I said earlier, the majority never smoke cannabis, and as we just saw, not only they do not smoke, but they don't approve of it. And when you use descriptive norms and injunctive norms combined, the effect might be even greater on changing behavior. So whenever you can use it because you have the right results and an overestimation of the use and an underestimation of the disapproval, you can have something very, very nice going on here. And for the gaming, as I said already earlier, the majority of the people from 12 to 26 stopped gaming if they have better things to do, and so they can keep track of their time spent on gaming. And those are the messages that we use in our campaign, as Rens presented earlier, and Hans already said a few words about it. So this is what we have, and again, the misperception of the norms actually work here, and hopefully our campaign is going to give some good results, and we will see maybe a difference in consumption in the future. So let's hope. We also asked for the 55 plus about their use and perception of peers' use for alcohol and medicine. Here, what we can see is, well, the majority of the people we received answer for were from Belgium, Limburg, and we had a similar percentage of men and women, and mostly between the age of 55 and up to 75. And here too, we found some overestimation of peers' use and definitely underestimation of protective behavior adopted by the peers. It's a bit less important than in the youth group, but still it's there, and we can do something about it, and therefore we can create our SNA messages and saying that, you know, that most of your peers actually drink less than you think. For the medicine, unfortunately, the question that we asked during the survey didn't really allow us to have this difference between perceived and actual use. But what, again, we can see here is that most of our respondents never use medicine, whether it's prescribed or unprescribed. And what we have found as well is that they most of them have a responsible handling of their medicine intake, and they follow the prescription of their doctors. So again, that's a very nice result and very positive. As for the opinion of the peers, again, for the alcohol, the numbers were not really telling us anything, the difference between what is perceived and what is actually thought is not as big as we could have hoped. But for the medicine, you can see at the top of it that there is also a underestimation of disapproval of using medication in a bad way, if I can say that, outside of a doctor's prescription. So the two messages that we want to keep here for the 55 plus population is that the majority of our respondents are drinking less than once a week, well, once a week maximum or less, and 97% of them have a responsible handling of their medicine with strictly following prescription and never taking more than prescribed. So again, very positive. You can find all those results on the euregional health atlas. I put the website address at the bottom, and in this website you can find a lot of different data from the AMR, and one of the themes is actually SNA, and you can have therefore all the results for youth and alcohol, youth and cannabis and gaming, or seniors and alcohol and medicine, and you can have that per region, per group age, per gender, and a few other variables that we measure during our survey. So this is a very nice tool to use, and you have other data as well from other projects from the EMR and Interreg project that you can have in the EMR. So it's a very useful website that can be used by a lot of different prevention workers. It's in English, but I think that sometimes the numbers speaks for themselves, so you should understand it quite easily. You can also download our different reports. There you can have them in Dutch, French, German, I think in English as well. So yeah, so you can have all those nice results. Yeah, not in Danish, no, unfortunately. But at least you have it in one of the three languages of all the partners involved in the project. And you have all the flyers also that we used, the reports, the infographics if you want to use them. And if you want to know more, of course, all the data are there. So